Hello everybody and welcome back to VetMap. Today we'll continue on the digestive system and we'll talk about the esophagus. First, just like always, we need to figure out what this anatomical structure actually is. So the esophagus is basically just a muscular tube that extends from the pharynx to the stomach, just caudal to the diaphragm, and is normally located dorsal to the trachea. But unlike the trachea, it does not have any cartilage elements, and that makes sense because the feed or water needs to pass through it, and we do not have one set size of the feed or the gulp of water that needs to pass through at one time, so it needs to extend without any interfering elements like cartilage. It also has three parts, and the mucosal and muscular layers differ between different species, as well as the angle that the esophagus enters the stomach. And here we have the esophagus and entering to the stomach. For the esophagus parts, so first we have the cervical part, pars cervicalis, which starts dorsal to the larynx until C5, so the fifth cervical vertebrae. It's dorsal to the trachea, and then it goes to left side of the throat just a little bit. Then we have the thoracic part, or pars thoracica, which goes through apertura thoracis into the thoracic cavity, and it starts on the left side because it entered that way, as you can see here, and then it ends up again dorsal to the trachea as it passes through the mediastinum till it hits the diaphragm. So it's very easy to remember. We start dorsal to the trachea, then as it passes through apertura thoracis, it goes a little to the left, and then we are dorsal to the trachea again. And as for the abdominal part, pars abdominalis, it goes through the hiatus esophageus, basically through the opening for the esophagus in the diaphragm. It enters the abdominal cavity, where it is now open to the stomach. And this is the area where it enters. Okay, now for the structure. Basically, it's easy to remember because esophagus has three main structures. If we dive into histology, there would be more, but for the main parts, there are three. Just like as for the location, it also is divided into three parts, so it will be easier for you to remember. So, three parts, three structures. So first we have the mucosal layer, tunica mucosa, that forms longitudinal folds that actually permit dilation. As I already mentioned, it's important for the esophagus to be flexible and adapt to the feed that is passing through it. So that's the mucosal layer element that helps this be accomplished. For the muscular layer, tunica muscularis, it consists of two layers that cross through each other in the proximal part of the esophagus, and then in a spiral configuration about the midsection, and then form an inner circular layers in the more distal parts. So let's say if you have a histological product of the esophagus, you can actually tell which part of the esophagus it came from, but it also varies between species, so we need to keep that in mind. And then we have adventitia, which just basically enforces the esophagus sticking to other functions, that it doesn't slip and doesn't fall out. So the cervical part of the esophagus attaches to the deep cervical fascia. In the thoracic cavity, we have the mediastinal pleura that it attaches to. And then in the abdominal cavity, we have the gasophrenic ligament. Again, a little more about its structure. As for the mucosal layer again, so the epithelium is stratified squamous type, and it hardens depending on the type of feed that is usually passed through it. So again, it's good to have that in mind, because let's say if a dog is always fed soft food from a can and then you start giving it like 2 years in like some sharp bones, there's a possibility that it's gonna be easier for the esophagus to get damaged and poked and all of those things, just because it's not used to that type of feed. So that is why it's good to keep the feed more or less the same. I mean, there are more reasons for this, but this is one of them. Again, all of the muscles are innervated by the vagus nerve, and when relaxed, as I already mentioned, muscles and the mucosal layer create a flower-like structure. So I hope this will be easier for you to remember if you are ever in an exam of histology again. So if you see like this flower or a star, know that the muscles are relaxed and they expand with need when the feed is being swallowed. Also, we have some glands in the esophagus, which you can see in this layer right here. And dogs have those glands throughout the entire length of the esophagus. Pigs have them only in the proximal part of the esophagus, so in the cervical part. And horses, felines, and ruminants have them only at the pharynx and the esophagus junction. For the muscles, we have main three. So these are dorsal, lateral, and ventral longitudinal esophagus muscles. And they just are based on the location. So if the muscle is on the top, it's dorsal. If it's on the side, it's lateral. And if it's on the bottom, it's ventral. And then we have two more muscles. The one that attaches the esophagus to the bronchus and then to the pleura. But only dogs have it. And also, muscle changes from striated to smooth in the caudal third of the esophagus for horses, then just cranial to the diaphragm for pigs, and then it's always striated throughout its length for the ruminants. And the reason why, I would believe, it's because ruminants need to ruminate, yeah, basically. So cows and camels and sheep need that function. So they do that by themselves, meaning that it's conscious. So that's why the muscles shouldn't be smooth, and that's why they need to be striated. Now the esophagus by species. We're almost done, don't worry. So for bovines, it's about 1 meter long. The cervical part is about 0.5 meter. Abdominal part is very short, just about 2 centimeters, and it opens into cranial sac of the rumen. And the antiparasitical moves are really good, meaning that it's able to ruminate. As for pigs, the esophagus is short, wide, but the muscles are thin. Also, they are able to vomit pretty easily. As for equines, it's about 1.5 meters long, and the muscular layer throughout the esophagus thickens from about 4 to 5 millimeters to 1.5 centimeters. And actually, the radius of the esophagus gets significantly slimmer before entering the stomach, and it also enters the stomach at a sharp angle, which creates a very strong sphincter, and it usually means that horses can't really vomit. So you really need to keep that in mind if you're giving fluids, or if you're flushing out a stomach, or if there starts to be a blockage, let's say in the small intestines, and the feed that has been in the stomach can't exit, so the stomach can rupture, and it's usually deadly for horses. You can't really do anything after the stomach ruptures. So keep that in mind, especially if you're giving fluids, you need to flush them out. So you need to keep track of how many liters of fluid you put in the stomach, because after the rupture, there's really nothing you can do. And for carnivores, in the pharynx and the esophagus junction, there is a thickening that creates basically like a step, just the thickening, and this is the Latin term for it. And there are two radiographs here. I just wanted to show you them as well for extra credit or whatever. So this is a normal radiograph of the esophagus, which basically means that you can't really see it if everything is okay. So here we have the trachea, and above it should be the esophagus, but we can't really point that out because it's not contrasting as does the trachea, because there's gas in it. And in this picture, we have a problem already, because you can start to see the margins of the esophagus. And this is actually megaesophagus, meaning that the esophagus is way bigger than it needs to be. So just remember that if you are seeing the esophagus, it means that there is either a blockage or there are gases or something like it, because you shouldn't really see it. So that's all for today. Hope you liked it. And there is the sources that I used. There are the sources that I used, and I hope you check them out. And I'm just glad you watched this video. So comment down below what else you want to learn, and I hope that this helped. Bye.